Pranam. Today at Focus on Health, we are honored to have one of the esteemed orthopedicians of our country with more than 2 decades of experience and conducted approximately 3,000 surgeries, spine, trauma, joint replacement, ligament reconstruction and deformity correction. And he is the head of the department of IMS Some Hospital and the founder of one of the well-known clinic, orthopedic clinic of Bhubaneswar, the Max Knee Clinic. Please welcome Dr. Aniruddh Dash. 2 months back, I was able to move my shoulder properly. But what happened now? What happened? I am not able to move my shoulder, neither I am able to lift it properly. So, can it have some disease? Can it is like some disease progression is going on? Yes, definitely. So, we'll come to know what is this disease. This is also a type of disorder. This stiffness, this pain for which you are not able to get the proper range of motion. It is a disorder. So let us know from Dr. Aniruddh Dash sir, what is this disorder and how you can prevent it and how it can be treated.
Frozen shoulder is basically a condition of the shoulder joint which is because of the pain and stiffness, and that is why it's commonly known as a frozen shoulder, because patient is unable to move his shoulder joints in all directions. There are various conditions where we have pain and stiffness of the shoulder, but here in frozen shoulder basically the abduction movement, which is like lifting of the arm and rotation of the joint, these are the two conditions movements which are commonly affected in a frozen shoulder.
What is a frozen shoulder and what are the stages?
The frozen shoulder can basically be divided into 3 stages. First is pain, then there is stiffness, finally there is thawing. So this depends upon the type of the disease which has affected the shoulder. So initially the pain may last for a few months, and then the stiffness that can occur between 3 months to 6 months, and finally the residual phase, that is known as the phase of thawing, that may take up to 1 year or 1.5 years.
What are the predisposing factors for frozen shoulder?
Frozen shoulder is commonly seen in patients who are suffering from diabetes, thyroid problems and Parkinsonism. So these are the patients who are most affected in frozen shoulder.
What are the treatment modalities for this frozen shoulder?
Frozen shoulder is basically a self-limiting condition, but since it takes a long time, patients come to the orthopedician for early treatment. So there are various different modalities of treatment. Most common is when the patient is presenting in a stage of pain, we can give analgesics and some fomentation and some local analgesics to reduce the pain. When the patient in the stage of stiffness, then he can be advised physiotherapy. Gradually the pain subsides, but finally there is some residual restriction of movements that can be taken part and taken care of by physical therapy and some surgical procedures like arthroscopic release and balloon inflation of the joint and manipulation under anesthesia. So we all know that frozen shoulder is a very common condition, and when neglected that can lead to disability. So early diagnosis and treatment and proper diagnosis can lead to a risk-free and pain-free joint.
Sir, can it be reversed without treatment?
As I told earlier, it is a self-limiting condition. So any patient who is having a frozen shoulder will self-limit and heal by itself. But since it takes a long time, that means I am talking in terms of years, months to years. So a patient who has frozen shoulder should visit a doctor and get early treatment so that his disability is not prolonged.